This is Debbie Bucher for Parkland College, and this is for the LPN to RN Transitions course. And today we'll be going over Chapter 11 in the LPN to RN Transitions book by Laura Claywell. And it's the nurses' ideas and forces that define the profession, and kind of gives you a historical foundation of nursing. So going back to the Middle Ages, most nursing care was performed by the religious orders, and during the Renaissance time, the influence of religious orders declined and helped along by the Protestant Reformation in Europe. Nursing continued to move more fully into the general population, and it was no longer primarily the province of only religious orders providing nursing care. And then later, nursing care became more secular and more structured, and more formal training programs were begun. So in 1099, it's the earliest documented nursing organization that was formed during the First Crusade. The Knights Hospitalists of St. John of Jerusalem provided hospitality and care to pilgrims and crusaders of the Holy Land. In the Middle Ages, the majority of care was performed by the religious leaders. Women, of course, were expected to stay in the home. In 1836, the Deaconess Institute at Kaiserwerth, Germany, was the first real school of nursing. This is where Florence Nightingale graduated from. And of course, Florence was instrumental in initiating changes that improved survival rates, particularly with the environment. The Industrial Revolution, women continued to push past societal boundaries to improve nursing education and patient care. And in the early 1980s, we began to see more changes, and the nature of healthcare began changing dramatically as we looked at cost reduction and quality improvement issues, which surfaced, and then thus managed care emerged. And then religious organizations, nursing was considered a calling. Knights of St. Lazarus, and then there was the Knights Hospitalist of St. John of Jerusalem, as well as the Alexian Brothers and parish nursing, of course, more recently. So nursing has been considered a calling as you give selflessly. It's hard work and you need to be dedicated and honored. And this was, of course, based upon religious values that nursing first began on relating to religious values. The Knights Hospitallers was a male organization that cared to travelers with spiritual goals, and the Alexian Brothers founded during the bubonic plague and still exist today in dual spiritual / nursing roles. And again, parish nursing is an example of giving and service back to the church that was most recently developed, probably within the last maybe 15 to 20 years, I would say. Parish nursing has developed. And of course, Florence Nightingale was you know, kind of one of the spokesperson for nursing. And she was highly educated with a high social standing. And during the Crimean War, she'd helped decrease the death rate from 42% to 29%. She's also known as a lady with a lamp. She established a nursing school as well and wrote a textbook. She changed nursing to become more of a respectable profession and believed nursing was an art and one that required organized, practical, and scientific training. Florence Nightingale was influenced by social and political forces and driven by inadequate health care for the hospitalized. She revolutionized the manner in which nurses cared for patients and instituted changes that affected patient survival rates, made nursing more appealing as a profession to young women, and profoundly affected modern day nursing. Some other people who played a historical role in nursing was Clara Barton. She was known as the Angel of the Battlefield during the American Civil War, and she organized the American Red Cross. So that's pretty awesome that she did that, because that's still very active today and is needed by many people. Lillian Wald established a visiting nursing service for poor families in New York City. Mary Breckinridge organized a frontier nurses organization in rural Kentucky that is still in operation today. Linda Richards is known as America's first trained nurse. And then also there's Isabel Hampton Robb. She helped reduce working hours of students and promoted licensure exams. Mary Adelaide Nuding wrote a book on the history of nursing. Lavinia Dock, she was a well-known nurse who fought for women's rights issues and for the right to vote. Mildred Montag helped promote creation of the associate degree as a shorter route into nursing, which was pretty huge. And also, major social factor affecting nursing is society's attitude toward the role of women. And again, Mildred Montag promoted the creation of the associate degree program, which I believe was in the late 50s to early 60s, I believe. So there's many different contributions and forces that have helped, form nursing today. And there was been many political contributions to professional nursing that have been made during times of conflict, such as the Civil War. Dorothea Dix was a Boston school teacher who had been crusading to improve care of the mentally ill in institutions, and also she organized a training program for women volunteers to care for the wounded. And during the Spanish-American War, this was the first time that trained nurses were accepted in military hospitals. And also in the Civil War, nurses were not nurses, but they actually were just called volunteers. And then in World War I, both the Army and the Navy had nursing corps. And World War II, nurses were involved in all aspects of care in the military, hospitals, on battleships, or flying on medical evacuation planes. And during the Korean War, the Vietnam War, Operation Desert Storm, and the War on Terror, nurses have always continued to assist the sick and the wounded. Question: a nurse knows that Florence Nightingale is also known as that's easy, the lady. And nursing today factors influencing practice is the aging population, the graying of America, and we need more knowledge for geriatrics and home care. Emphasis on health promotion and disease prevention is much more today than what it ever has been. Nurses counsel and teach patients about health screening, dietary needs, exercise programs, treatment regimens, and self-care. There's a growing number of elderly, and by the year 2030, there will be 65 million older people, and with that comes increased healthcare needs and chronic needs and cost. The elderly utilize more healthcare dollars than younger members of the U.S. population, which of course makes sense, but the elderly typically are less educated, rely on Social Security for finances, have chronic illnesses, and are widowed. And we need to provide geriatric nursing experiences and education for the increasing numbers of the elderly. Nurses must have a number of competencies in the areas of knowledge, skills, attitudes, and personal characteristics. Multidisciplinary knowledge includes an understanding of the determinants of health and background and theory to facilitate learning, change, and healthy lifestyles. We need to continue to collaborate and communicate and hone our assessment skills, and just being a healthy role model is a strong characteristic in health promotion. And patient care will be affected by the aging population, health maintenance, uh, disease prevention, outcomes-oriented, cost containment, and quality improvement are all measures that we were looking at. So we need more nurses to help care for the elderly in the future. Outcomes-oriented patient care. Nurses need to work with population groups as well as individualized patients to develop health-related goals. Nurses play an important role in helping achieve positive experiences for patients with minimal complications. And nurses work again with population groups as well as individualized patients to develop the health-related goals. So again, we're all about helping to provide the best possible care with a positive experience with at least the minimal amount of complications, hopefully, is what we strive for. And of course, like we talked about, other factors influencing nursing practice today are cost containment, managed care. It's an insurance-based approach to reducing cost. There's DRGs that established during the early 80s to help establish pretreatment diagnoses, billing categories, preferred provider organizations or PPOs. Patients receive a discounted rate for services when using the specified physicians or agencies. And then, of course, there's the health maintenance organizations or HMOs, and this is a group healthcare agency that has a prepaid fee. And of course, the main focus of patient care is the current healthcare environment. In the current healthcare environment is to contain rising costs. Hospitals are faced with financial difficulties and are merging into larger healthcare systems. DRGs, PPOs, and HMOs are really commonplace these days. Consumers are responsible for paying for their own healthcare and are dependent on third-party payers to afford treatment. Nurses are challenged to provide quality nursing care in an environment that limits consumer options. Case managers are involved in a managed care system, and they help to provide coordinated patient care as the patient moves through the system. And of course, we're all about, looking at cost containment, managed care, making sure that we're only using supplies as we need them. It's certainly a much different age in nursing now than what it was, 20 to 30 years ago. And as we talked about managed care, Medicare is the national and state health insurance programs for older adults. Prospective payment system limits the amount paid to hospitals that are reimbursed by Medicare. It uses the DRGs. And then Medicaid, of course, is a federal public assistance program that helps assist those with financial needs. And social, economic, and political forces, they all influence healthcare and the type of nursing care that is needed. Quality improvement is looking at the quality of care. Continuous quality improvement is a process in which the quality of patient care is continuously monitored for effectiveness. Set of standards that produces excellence, and there's also clinical care pathways or care paths that we also can use to help with the quality of care. Quality of care is assessed from the time a patient enters the hospital through discharge and to include transitional care. All disciplines should be involved in measuring patient outcomes against standards that promote excellence. Many organizations utilize clinical pathways or care paths or standardized care plans as a format to ensure patients are on the right track to meet outcomes. As problems are identified, action should be taken to prevent complications and increase length of stay and avoid readmission for the same condition. The Affordable Care Act added sections to the Social Security Act that establishes the Hospital Readmissions Reduction Program, which requires the CMS or Centers for Medicare and Medicaid Services to reduce payments to hospital with excess readmissions and effective for discharge beginning October 1st of 2012. So this is pretty critical. If a patient is admitted to the hospital and they do not have any type of skin breakdown, but then they have skin breakdown during the hospital stay, sometimes hospitals are reducing how much they're going to reimburse. And if a patient comes in to the hospital, you want to do really good assessments and documenting whether the patient has any skin breakdown as they enter the hospital. And again, they want to make sure that the patients are being well cared for so that they're not getting pressure ulcers during their hospital stay, because many insurance companies, including Medicare, will not pay for the care for that wound because it was deemed preventable during that hospital stay. But if they do have it documented when they came in, then I do think that they will provide for at least some reimbursement for the supplies and the care needed for that wound. Okay, I'm not sure that this was recorded, so I'm going to go back over this again, but the ANA has a nursing social policy statement that states provision of a caring relationship that facilitates health and healing, attention to the range of human experiences and responses to health and illness within the physical and social environments, integration of assessment data with knowledge gained from an appreciation of the patient or group. Also, it's the application of scientific knowledge to the processes of diagnosis and treatment through the use of judgment and critical thinking, advancement of professional nursing knowledge through scholarly inquiry, influence on social and public policy to promote social justice, and assurance of safe, quality, and evidence-based practice. And also, it's the application of scientific knowledge to the processes of diagnosis and treatment through the use of judgment and critical thinking. Oh, I think I've already said that. Yeah, and assurance of safe, quality, and evidence-based care. And a question, a nurse is discussing DRGs, PPOs, and HMOs. Which concept is the nurse describing? And of course, two, it's the cost containment. This now concludes the lecture over Chapter 11 in the LPN to RN Transitions book on the nurses' ideas and forces that define the profession. And it gives you kind of a historical background to where and how nursing got started and to where it is that we are today. Thank you.